Hello, is it Mrs. Williams?
Yes.
Hello, my name's Dr Tarbuck. Nice to meet you.
How do you do, Doctor?
And are you Mrs. Williams' daughter?
Yes, I am. Elizabeth Johnson.
Mrs. Johnson, hello, nice to meet you. What I'd like to do is spend the next 10 minutes or so talking with you both and asking you a few questions, really to see how we can best help you once you leave hospital.
Good, Doctor, because I do want to get home as soon as possible.
I'm sure you do. I'm sure you do. Perhaps I could start off by asking you, Mrs. Williams, how things were before you came into hospital.
Fine.
Okay.
Got my own nice little house, I was perfectly all right.
Right, and do you live on your own there, or?
Well, I'm married. I'm married to
I
Bert.
see. And is your husband there at home?
Yes. Oh, wait a minute. No.
No,
No,
do you
he-
remember he was poorly, Mum? Do you remember?
Oh, he was poorly.
Oh,
He
I'm
had to
sorry
go
to
away
hear
and be
that.
looked after, yes.
Right. So is he in a
He's,
residential?
yes, he's in a residential
I see.
home now.
So you were living at home on your own?
Yes.
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 And were you having any help at home at all?
Oh, well, Elizabeth comes round quite a lot.
Right.
And, there was that other young lady
Yeah.
who comes,
The
that I see quite a lot.
Right. Was that
Oh,
home,
from the
Home
social.
help.
Home
Yes,
help.
home help.
Oh,
Right.
right.
And-
Well, yes, that's right.
And
yeah.
how often was she coming?
Well,
Oh, she
she-
was coming for lunch, wasn't she? Once a day.
Once a day.
Once
Oh.
a day.
Right.
Right,
Helping you
yes.
with your lunch and all that, wasn't she?
Oh, that's right, yes. And she never does the washing up.
Okay. And had you noticed any troubles with your memory at all before you came into hospital?
No.
Oh,
No.
Okay. Mrs. Johnson, had you got any thoughts on that?
Well, yes, I think there had been some issues, but while Dad was there, obviously they were managing fine
Right.
together.
Elizabeth, I'm perfectly all
I
right.
know, darling, I know. But once he had to move into the home,
Yeah.
it became apparent that some things were
Okay.
being forgotten.
Right.
But we went to. You remember the doctor? We went to the doctor, and he gave you those tablets to help you with your memory.
Oh, those pills I have to take, yes.
Right. And
Yes, I remember. Yes, you took me.
so the tablets to help with your memory. Yeah.
I s-
And do they help?
I don't- I expect so, if they're doing what they're supposed to.
Yeah. Do you think, have you noticed the
There
difference?
was a small improvement.
A small improvement.
yes.
Okay, good.
Yeah.
Good. Okay, and then if we can move on a little bit. So I understand you had a fall.
Well, I must have done, because I know I don't remember very much about it, Doctor. I've got a sore leg now.
Right. Yeah. I
Was
believe.
that when I fell? Did I do that when I fell?
Do you remember? And then the home help, she found you in the kitchen. Do you remember when she came round to make you lunch?
Right. I believe you actually broke your hip, didn't you? And you've
Did
had.
I?
Yeah. And you've had an
Yeah.
operation on it.
Oh, that must be why I'm in here then.
That's right.
Ah.
That's right. Yeah. And can I ask how are you walking now?
Fine. I'm perfectly all right.
Good. And
I get down to the toilet and everything.
right. And do you have to use a stick or a frame? Or?
Oh, well, they have given me that thing,
The Zimmer frame,
Zimmer
haven't
the
they?
walking
And-
frame, yeah.
Yeah.
Are you
I
good-
don't really need it. I'm
Right.
sure I
do you,
can get.
Do you use it or do you tend to
I have.
not bother?
Well, I'm sure I can manage without it.
Right.
I'm sure I don't need
Okay.
it.
Right. And have you noticed any change in your memory since being in hospital?
No,
No.
no.
Okay. Have you noticed any change in your memory?
I think there's been quite a deterioration
Okay.
while Mum's been here, but I mean that's only understandable.
want
Mum
to
with
go-
all these tablets
Yeah.
and things.
It-
Yeah, no, that's why I want to go home,
Yeah,
Elizabeth.
you've been
No,
through a
darling.
lot, so it is quite understandable. Mrs. Williams, would you mind if we just quickly went through some questions just to look at your memory a little bit?
No,
But-
if you think it's a good idea.
I think it'd be very helpful for me. You have to bear with me because some of the questions are a little bit silly.
Oh, well,
Okay.
I'm not very good at quizzes.
Okay. Let me start off by asking you how old you are.
Oh, I'm 76, would it be? 76,
Okay.
77?
And
70 something.
That's
anyway.
fine, okay. And could you tell me what the time is at the moment?
Well, we haven't had tea yet. They haven't been round with the tea trolley, so I don't know. I haven't got a watch on. It must be about lunchtime, I suppose. Don't really know.
Okay, that's fine, thank you. And I'd like to test your memory a little bit. I'd just like you to try and remember an address for me. Okay.
Oh, yeah.
It's 42 West Street.
42 West Street.
That's
I don't know
right.
anybody who lives in West
No,
Street.
No,
no,
we
you
don't.
don't. It's just an address because
Oh.
I'm going to ask you again in a few minutes. So see if you can remember that for me, okay? And could you tell me what the year is at the moment?
Oh, I know there's something big coming up, some big event. It must be 1999.
Okay. And
Yeah.
can you tell me where we are at the moment?
Well, I'm in hospital.
That's right. And could you tell me the name of this hospital?
I don't know. I don't remember arriving here. Perhaps I was asleep or something when we came.
In the ambulance, you
okay.
probably were.
Well, I
Yeah.
wouldn't see, would I? I wouldn't know where they brought me.
That's fine. Okay, let me ask you something else. Could you tell me what my job is?
You're the doctor.
Okay.
You're Dr Tarbuck.
That's right, well done.
Is that right?
Good.
Oh.
And can I ask who's this sitting next to you?
Oh, it's Elizabeth. That's my daughter.
That's
And
right.
she's got a brother called Charles who never comes to see me.
Okay. And could you tell me what your date of birth is?
I was born in 1932
Uh-huh.
and my birthday's in June on the 18th.
Right. Okay.
Yes,
Thank you.
in the
And
summer.
good. And could you tell me the year in which the First World War started?
Well, everybody knows that. 1914.
Okay. And could you tell me who's on the throne at the moment? Who's the monarch?
Oh, well, it's the Queen, isn't it?
It
Oh,
is.
she's lovely. I
That's
remember
right.
her coronation. It's
And-
beautiful.
and could
That's
you-
why we called you Elizabeth after the
Wasn't it?
Queen. She's Elizabeth.
Queen Elizabeth, very good.
Yes.
Okay. And this is a strange one. Could you count backwards from 20 down to 1 for me?
It's a funny way to count, but
It is.
if that's what you want. 20, 19, 18, 17, 16, 15, 14, 13, 12, 11, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1.
Thank you. Okay. And last question. Could you tell me that name and address? Or the address?
What address?
Do you remember I asked you to remember an address?
Did you?
for me?
Yeah, you didn't. You didn't tell me an address. I can tell you my address if you want, but it'll be on your form.
Okay. That's fine. Okay. Perhaps I could sort of move on a little bit and talk about how things are at the moment. Because obviously you're in hospital at the moment.
Yes, and I do want to go home. The food's terrible here, and
And I believe
That's what
Yeah.
we're trying to
yeah,
do.
I believe you did have a visit home recently with the occupational therapist and the physiotherapist.
Do you remember?
Do you remember?
you came and picked me up in the car, and there was a young lady, very bossy young lady,
She was a bit.
and she went poking round my house, and I didn't like it. I didn't like that. I don't like strangers going round my things.
Okay.
And she kept telling me what to do.
Right. And do you remember what suggestions she made?
Oh, she wanted to move the furniture round. I remember that.
That's right.
And
I think she wanted you to have your bed downstairs, didn't she?
she wanted me to sleep in the dining
That's
room,
right.
and I said no.
That's right.
That would spoil my dining room. I don't want to sleep in the dining room. I've got a bedroom.
Do you understand why she suggested you had the bed downstairs?
She was just being bossy.
I think the reason for it was because she was worried about you going up and downstairs when you're on your own.
Well, I've been going up and down those stairs for years and years and years, and
Yeah, but you've
They're very
Do you remember
stiff,
you-
Mum.
yeah,
they're very
but
steep
I
and you-
didn't fall down the stairs.
No, I know you didn't.
No, but you have broken your hip now, and your mobility isn't as good as it was, and
No,
you're
but
having
I
to use a
can-
frame.
I can get round, and there's the thing up the side I can hold on to.
Okay, can I ask you, where is the toilet and the bathroom? Are they downstairs or upstairs?
They're upstairs.
So you'd need to get up and downstairs, wouldn't you?
Yeah.
Yeah. And did they also make some suggestions about you having some help at home?
Oh, she did. Yes, I remember,
remember?
Elizabeth. She wanted me to have somebody coming in. I don't want people coming in and interfering and poking round my
If it
things.
was to help you.
I don't need help. I don't need help to get dressed, Elizabeth. I can
Well-
dress myself.
Because you are very keen to get home. You've already
Yes.
made that very clear.
Yes.
Do you not think it would be a good idea to have some help to get you back home safely?
I don't want more people coming in. It was bad enough having that woman from the social coming in at meal times, but
Yes, but you've had this accident now, Mum, and it'll take you a little while to get over it.
I'm
won't
getting
it?
better, and I'm sure I can manage.
Do you think we might be able to persuade you to have a little bit of
I
help?
don't want to have my bed in my dining room. Spoil the room. And what happens if people come for a meal? Can't have them in bed there. I
Because I
don't.
think we're just concerned about your safety and making
Yes.
sure that you are safe to go home.
I'm perfectly all right. I can manage.
Okay, I'm not going to be able to persuade you, am I?
I tell you, I don't like people coming in and interfering and poking round in my things.
I know.
And I don't want to move the house round. I don't want to upset it all. It's been like that for years.
I know.
I think we're going to have to just agree to disagree on this point for the moment, aren't we? Okay. Thank you very much for talking with me. Thank you,
thank
Mrs.
you.
Johnson.
Thank you, Dr. Tarbuck. I'm Dr. Coll, your assessor today. I wonder if you could discuss your findings concerning Marjorie Williams' capacity to decide about returning home, indicating what are your bases for your conclusion.
Thank you. On the basis of my interview with Mrs. Williams, it's my conclusion that she lacks the capacity to make the decision regarding returning home. My reasoning behind that is, first of all, I think there is evidence of a mental disorder present. She has a significant degree of cognitive impairment. On the basis of such a short interview, it's not possible to give a definitive diagnosis, but I think she does have a form of dementia. Moving on to the 4-stage test of capacity, Mrs. Williams is able to understand the information given to her, but she has difficulty in retaining it for long enough to make a decision. She doesn't believe the information given to her, so I feel that she is unable, therefore, to weigh it in the balance and make a valid decision. But she is able to communicate clearly. So she fails 2 out of the 4 steps of the functional test of capacity and therefore lacks capacity in this area.
Thank you very much.